Does your cat seem to be visiting the litter tray more often than normal? Is it taking longer to empty their bladder? Do they seem to be straining, or are they a bit more grumpy than usual? Well, cystitis is a pretty common issue in our pet cats, but if you think a shot of antibiotics will make them better, I'm afraid it's a little more complicated than that. Hi, I'm Dr. Alex Avery from ourpetshealth.com, helping you and your pet to live healthier, happier lives. Now, when we think of cystitis, our first thought is of a bacterial infection must be the cause, and that a short course of antibiotics will quickly clear things up. While that might be the case in dogs and in people, cats are far more complicated, as always. Now, infection is a fairly uncommon cause. In fact, feline idiopathic cystitis accounts for the majority of cases. It can also be known as feline lower urinary tract disease, and idiopathic simply means that no one knows exactly what the cause is, although it does share many similarities with interstitial cystitis in humans. Now, there is no single test that can be used to diagnose your cat with this condition. Instead, your vet can rule out other causes. Now, these might be bladder stones or sludge, cancerous masses and infection. This diagnostic workup can be done with x-rays, ultrasound and urine testing. Now, in some cases, blood tests will also be advised to check on kidney health or any other concerns your vet may have. Very often though, in the initial stages, a presumptive diagnosis will be made without the full range of tests, and a more thorough workup only needs to take place if the problem is more severe, if it doesn't clear up as expected, or if it quickly comes back. Now, if these tests all come back as negative, then the diagnosis of idiopathic cystitis will be made. So even though we don't know the exact cause of this disease, we do know there are a couple of things that can really increase the risk of your cat becoming infected. The first of these is stress and an abnormal stress response. Now, you might feel that your cat lives the life of Riley, but very often they are under a certain degree of stress. Now, this may simply be due to living inside and sharing their environment with another cat. There's always stress in a multi-cat household, no matter how well they appear to get on. There may be more obvious stresses, such as the arrival of a new baby, having the builders round, fireworks season, or a new cat may have moved into the neighbourhood. Now, stress alone is not enough, or else every cat would develop idiopathic cystitis. Something else that seems apparent is the fact that cystitis cats seem to have an abnormal stress response. They release different levels of stress hormones compared to unaffected cats, and in some way this affects the bladder. Now, our second predisposing factor is the disruption to the normal mucous lining of the bladder, along with inflammation to the bladder caused by nerve signals sent straight from the brain. Now, the bladder is normally lined by a layer of mucus that protects it from the harsh urine that is contained within it. In cats that develop cystitis, it seems that this layer is disrupted, which causes damage to the cells lining the bladder. And this causes inflammation, ulceration and so pain. Now, why this abnormal layer develops is not clear, but it also seems that signals sent to the bladder from the brain, possibly due to stress, can actually also cause inflammation and pain in the bladder. Now, this may also play a role in the disruption of the normal protective layer. What this all means is that certain cats are likely to be genetically predisposed to developing cystitis, and their environment then just tips them over the edge in one way or the other. Now, knowing this allows us to make management changes to cats that have had episodes of cystitis. This treatment can help to prevent repeat episodes in the future. As we learn more about this disease, new approaches may be suggested, so really watch this space. So what treatments can we give? Well, we can split treatment into actual treatment of a flare-up and then preventative treatment for long-term management. In the short term, feline idiopathic cystitis is actually a self-limiting disease, and this means that it will tend to get better by itself given time, often within 2 to 5 days. Now, giving pain relief dispensed by your vet and encouraging water intake during this time should see the majority of cats remain comfortable, and the symptoms should pass uneventfully. Remember that infection is actually very rare, and so antibiotics are generally not needed. With males, there is also always the risk of a blocked bladder from developing. If you have a male cat, make sure to check out my video of why your cat can't pee. It's a real emergency. In the long term, half of all cats will experience at least one more episode of cystitis within a year of their last episode. This is potentially a really long-term condition, and so long-term management is really important in any cat that has had an episode of cystitis. Management focuses on two aspects: reducing stress and increasing water intake. Now, you might not feel that your cat is stressed, but if they suffer from cystitis, then they will be. Cats are very good at hiding problems, and so stress can be hard to spot. In reality, there's a lot of things in a modern cat's life that can be the source of underlying stress. This includes multiple cats in a house, competition for resources such as food bowls, water and litter trays, being confined inside, going for long periods without owner company, or alternatively having interaction forced on them, and finally strange cats competing for territory. A lot of cats will have one or more of these factors present in their lives. Trying to correct them will help a lot in preventing future cystitis. And small changes in your house can make a huge difference. So what exactly can we do? Well, there are 4 broad areas we can target. Let's start with food bowls, water bowls and litter trays. The number of each of these should be 1 more than the number of cats in your house. So if you have 2 cats, then there should be 3 food bowls, 3 water bowls and 3 litter trays. Food and water bowls can be next to each other, but each feeding and toileting station should be separate from each other to allow your cat to access them without having to be next to each other. It's also important to make sure litter trays are in a quiet location and to clean out promptly. Some cats will refuse to use a dirty litter tray. If they hold on for a long time, then they may be more likely to develop cystitis. Now, our second target is space. Cats are very 3-dimensional in the way they interact with their environment. They just love to climb, to sleep off the ground, and to have safe retreats. Now, for our indoor cats, providing raised sleeping platforms, climbing frame style furniture, having cupboards they can climb into and explore, as well as having quiet, secluded sleeping areas, can all help reduce a cat's stress levels. These changes are also great for cats which go outside. They may only want to go out for a short period of time due to the weather or because other cats are in the environment. They may feel it's too dangerous to go outside at certain times and so be restricted indoors. This also means that if possible, your cat should have a free choice to go out when they choose rather than being forced out at specific times. Now, securing your home is at number 3. Now, imagine if a stranger kept coming into your house and eating your food and using your toilet. You'd be pretty stressed out, and so is your cat. If you have other cats coming through your cat flap, then consider a more secure type, such as one which reads your cat's microchip and only opens to them, not any old moggy. Routine also helps feelings of security. Where possible, try and be consistent with meal times, with people in the house, with noise levels, and with degree of interactions. Now, some cats love interaction with their owners, others only like it on their own terms. Be consistent and don't force your cat. Okay, so at number 4 is extra help. For those cats that are super stressed or during known stressful events, some cats will benefit from just a little extra support. Now, this can take the form of certain dietary supplements or even pheromone therapy. FLUTD is an excellent, safe product for all that can really help to relax a stressed out kitty. Your vet will have other suggestions that will be suitable for your cat. For more details and extra tips on creating a stress-free environment for your cat, as well as learning how to tell if your cat is stressed, then watch out for future articles and videos on this topic. Now, moving on to how to get cats to drink water. Now, this is the second cornerstone of prevention. Cats generally have a very poor drive to drink, and many people will never really see their cat use the water bowl. As such, it can be a real challenge to get more water into them. Well, the following may just help. Change from dry to a special prescription wet diet. Wet food is 3/4 water. If a cat won't eat a wet food though, then a prescription dry diet is probably the next best food. These are designed and proven to reduce the number of flare-ups in a cat with cystitis from suffering, and it also makes any flare-ups less severe. Extra water can also be added to your cat's diet, although again, that may put some cats off eating it. Now, use shallow bowls for water can help. Cats will often not drink if their whiskers touch the sides. Also, experiment with different material bowls. Your cat may prefer plastic or metal or glass or china, as each one has subtle flavours in the water that your cat may be picking up on. On that note, you can also flavour the water using something like dilute tuna juice or chicken broth. Just avoid any high salt additives. Even if just plain water is used, regularly refreshing your cat's bowl, even if it looked untouched, is important, and using filtered or distilled water may also help. For those who really won't drink from a bowl, they may just love running water. Use a cat fountain. Now, this is a great way to provide running water without needing to keep the tap running. Again, for more details on how to change your cat's diet and how to encourage your cat to drink more, then look out for future videos. There have been several drugs that have been put forward for the treatment and prevention of cystitis. These generally either target the bladder with the aim to try and replace or repair the protective layer of mucus that becomes disrupted, or those that aim to reduce stress. Now, the first type are known as polysulfated glycosaminoglycans and come in injectable and oral forms. Unfortunately, there is little evidence to show that they consistently have a significant benefit. They are, however, very safe and could be something to try if all of the above strategies fail to control the disease. It is important though that your cat doesn't become stressed when you actually give this treatment, or else you may be just undoing all of your hard work in reducing stress levels. Finally, stress-relieving drugs such as the antidepressant amitriptyline can be used in cases of severe persistent cystitis. These can be very effective, but also come with potential side effects and so are unlikely to be the first thing your vet suggests. I hope this video helps you understand the sometimes frustrating condition of idiopathic cystitis in cats, as well as to give you some really useful changes that you can easily make to help prevent future episodes of this disease in the future. If you have any questions, or if there are any tips that you have that have helped your own cat with this condition, then I'd love to hear them. Please leave them down in the comments below. Also, if it's your first time here, consider subscribing to make sure that you don't miss out on future content and allow me to continue to help you and your pet to live a healthier, happier life. So until next time, I'm Dr. Alex from Our Pets Health, because they're family.